All right, now that we have enough people here, I'd like to call the March 3rd, 2022 Health Committee meeting to order. We have 4 members present, so that does give us a quorum. First thing I'd like to do is to introduce Ashley Scarborough, who is our new civil state's attorney, second civil, whatever the total correct title is. And she is here tonight. So if you have not met her, say hello to Ashley. We have minutes to approve from January 13th and January 31st. One was the special meeting and the other one was the regular meeting. Do I have a motion? Motion by Martin, second by Chung. Any additions or corrections? Hearing none, all in favor? Aye. I guess I have to vote too, aye. Any opposed? Nope. Okay. Minutes are approved. If the committee doesn't mind, I'd like to move up the payment of bills and transfers because member Chung has to leave early, so we want to make sure we get the bills paid. So does anybody have any objection to that? Okay. And the auditor has reviewed all the bills and they comply with all of our ordinances, resolutions, and policies under our county code. So first is Board of Health as a prepaid total of $111,220.06. Motion by Metzger, second by Chung. All in favor? Aye. Any opposed? Okay, that passes. Developmental Disabilities Board has a prepaid total of $101,124.62. Motion by Chung, second by Metzger. All in favor? Aye. Any opposed? Okay, and I voted aye. Nursing home has a prepaid total of $171,534.87. Motion by Martin, second by Chung. All in favor? Aye. Any opposed? Okay, that one passes. And jail and JDC Medical has a prepaid total of $52,949.26. Motion by Metzger, second by Martin. All in favor? Aye. Any opposed? Okay, the bills have been paid. So we will then, do we have any members of the public?
We have no requests.
Okay, thank you. Departmental matters. First up is Jason Tabb, juvenile detention.
Good evening.
Good evening.
You have my report in front of you. I don't have anything to add. If you have questions, I'll be happy to answer them.
Anybody have any questions? Okay.
Thank you.
Next is Jessica McKnight, Health Department Administrator.
Hello.
Hello. You have 3 items for action. First is request approval of an ordinance of the McLean County Board amending the 2022 combined appropriation and budget ordinance for Fund 107. Motion by Metzger, second by Chung. Want to explain?
So this is adding into the 2022 budget monies for COVID-19 grants that we have received from IDPH. So now that we know the amounts, can add those into this year's budget.
Right. And the Board of Health passed all of these this last month. So any questions? No? All in favor?
Aye.
Aye. Any opposed? None? Okay, that one is approved. Next is B1B is a request approval of an emergency appropriation ordinance amending the McLean County fiscal year 2021 combined annual appropriation and budget ordinance for Fund 110. Motion by Martin, second by Metzger. And this is a cleanup?
Just end of year cleanup.
Okay, any questions on that? Okay, all in favor? Aye. Aye. Any opposed? Okay. And then we have B1C is request approval of emergency appropriation ordinance amending the McLean County fiscal year 2021 combined annual appropriation and budget ordinance for Fund 107. Motion by Martin, second by Chung. And this is also another cleanup, correct?
Correct.
Okay. Any questions? All those in favor? Aye. Any opposed? Okay, and that passes. So now we're on to your report.
Yes. I don't have anything to add, but I'll be happy to answer any questions.
Any questions for Ms. McKnight on her report? No? Well, okay,
Thank you.
well then, thank you. All right, next is Tim Wiley, Nursing Home Administrator.
Hello, I don't have anything to add. Be happy to answer any questions that you might have.
Anybody have any questions about his report? Okay. So,
I want to clarify, I had finance last night, I think. The days are mixing up.
today's Thursday. You had finance yesterday?
We did.
Okay.
And so the total number of residents at the end of this, you have an average, annual average. So your census right now is 84.2?
It was at the end of the reporting,
For February,
at the end of January.
okay. And what I don't see, and it's just, maybe you're not, are you just going to use the same financials? The financials for, see, I'm not sure if I've got the same financials. So the financials, do you get your numbers also from the treasurer?
Actually, from the reports that we submit to the treasurer.
Okay, so then she is the one that has put this together then. All right, if I have any questions, because I was searching through for this and I didn't get to look at it before, so I will reach out to you, okay?
And then for the census, for the graph, I made the graph 6 months rolling since we're starting a new year. That way we can see trending.
Okay. Thank you.
And then just a quick clarification on the target numbers. Those are some preliminary incremental growth, and then the projected revenue increase I'm trying to present to everyone at the facility level and at the county level, the significant impact financially that just simple incremental growth can bring to our revenue.
So these numbers in your report are for January?
Which numbers?
The numbers that would be on page 20 and on page 20 and then, yeah, on
Yes.
page 20. Okay, thank you.
I think sometimes the treasurer's almost a month behind on some of this, and we have, and it kind of, because of the timing of when she does her reports, and then, right,
Figure that out right now.
Right.
If I have questions, I can reach out to both Becky and to you.
yeah, and like I said, I know in the past we have had
Trouble
trouble
and then they
reconciling.
work together.
Yeah.
And now it doesn't
Yeah.
look like they're together.
So I
Tim, thank you.
I would also offer county administration to be a point of contact, and Kathy Dreyer can assist with that as well.
okay. So and maybe it's not relevant, but I've read some things about increasing nursing home. I don't know if it's reimbursement, staffing. I don't know if it's at the federal or the state level or both. So what do you know about that, and how would that impact us in a positive light, hopefully?
So there has been new regulation at the federal level that's coming out regarding staffing and staffing numbers. The good news is, based on my experience the last several years, the staffing numbers that we are able to maintain on the floor at the county home are very strong. And I'm not concerned about the impact that there would be from a regulatory standpoint on our facility.
So it's kind of maybe more targeting like for-profit, private type homes. Is that what I kind of read into that maybe?
Nationwide, there is an issue with understaffing that seems to be more typical to the industry. But I personally feel like even prior to my arrival, the county home had maintained really good staffing ratios on the floor, and we're gonna work hard to keep that going.
Okay. But there wasn't any change in reimbursements, increasing reimbursements?
My understanding, at least at this point, is the regulation will affect reimbursement. So staffing numbers will come into play into Medicare's reimbursement rate, whereas it did not in the past.
I just wasn't totally clear on all of that stuff. So, any other questions, Member Martin?
And this question might be better answered by Cassie, but are we looking at changing the brand sometime in the near future for the county, the name of the establishment?
Yes, this is an issue that was brought to our attention from prior administration, but also a recommendation from the Blue Ribbon Panel. And there were some strategic reasons why we didn't move forward with that in years past. But Mr. Wiley has brought it to my attention that there is a desire to do so for as an administrator and at the facility, and I believe that there would be support for that in administration and the board as well. So we are absolutely have that on our radar.
Anyone else? Thank you. Next is Suzanne Scott from Adult Detention Medical, and she is not here today. So does anybody have any questions that Ms. Taylor could take back if needed? No. Okay. Thank you. Next is Ms. Taylor, County Administrator.
Thank you, Chairman Schaefer. I have nothing to present for action this evening. I would note that even though the department does not report to this committee, we will be having a Behavioral Health Coordinating Council meeting on the Friday after board on that Friday, March 11th at 7:30 a.m. And we will be presenting a behavioral health action plan update for the county. It has been a lot of hard work in the past year dedicated by Chairman Schaefer and many others in the redesigning of the look of the plan, but also looking at those metrics and updating the work that we have done and the commitment that we have to behavioral health in McLean County. So that is going to be an update that is hasn't been updated in the last 6 years, and we're looking forward to having that published.
Thank you.
Congratulations on getting that to this point.
It was work, a lot of work. Is there any other business or communication? Ms. Morlock?
I apologize, but we have some transfers that need to be approved that were in the packet. That's all. So I just wanted to make sure you got that done in case Sharon needed to leave. Thank you.
So we have transfers that I missed, sorry. And let's just take them all at one, and we'll have one motion, and then if there's any discussion, then we can. So there's 4 transfers in the back of the packet. Can I have a motion? Motion by Martin, second by Chung. Is there any discussion, questions about those transfers? A lot of these are cleanups, right? So. Okay, no questions? All in favor? Aye. Any opposed? Okay, we did the transfers. Thank you, Ms. Morlock. Any other business or communication? We have to get used to meeting on Thursdays at a different time, so there's a reminder in here. And if there's nothing else, then we are adjourned. We got you out of here in time.